Welcome to Lubby's Chat, a podcast about relevant discussions taking place in the Miami-Dade County Public School Board. Your host is the school board member for District 7, Lubby Navarro. Today's episode was recorded online via Zoom call during the 2020 pandemic. Thank you for listening.
I want to welcome everyone who's listening to my first Lubby's Chat today. It is my podcast that I'm starting during the pandemic 2020 to be able to inform our community about important topics with Miami-Dade County Public Schools and to all of our listening audience in Miami-Dade County and beyond. I am Dr. Lubby Navarro, school board member for District 7. Today, we have the honor of having one of our very esteemed administrators at our school district, Miss Sally Alayon, Assistant Superintendent of our Mental Health Department, here with us today to be able to share some important insight and information about the services that we have. I mean, we have seen reports across the country about what is happening during the pandemic. We're going on 5 months of practically a lot of isolation, a lot of families and children specifically being locked in, being home from our schools since March and having a lot of beautiful time with their family, but a lot of time where they don't have the ability to talk to their friends, play with their friends, and what that toll does on an individual, not only just a child, but the entire family. So I want to welcome our special guest, Miss Sally Alayon. I know, Miss Alayon, you've been working around the clock to be able to provide information to our parents and our community. And so I wanted to bring you on today so that you could share some of the important things that Miami-Dade County Public Schools has been doing in mental health, especially now, even more critical. We continue to be home. We continue to be a hotspot here in South Florida. We still don't know whether schools are going to be opening. Give us some information, Miss Alayon, in terms of what can we do to help our children and help our adults and families in our community during this difficult time.
Absolutely. First, I just want to give a little history real quickly about the Department of Mental Health Services. We are about to embark on year 3 of the Department of Mental Health Services in Miami-Dade County Public Schools. This department was formed through the great vision of our superintendent to ensure that we were absolutely meeting the mental health needs of students. After the Marjory Stoneman Douglas tragedy, all districts in the state of Florida received funding in the form of a mental health assistance allocation. And that money was to enhance the work that was already taking place within school districts. So here we are. We've completed 2 years with the new department, and we're now moving into year 3. One of the biggest pieces that was added to this body of work was the addition of 65 positions of mental health coordinators that we have throughout our K-12 schools. Every one of our schools has one of our mental health coordinators tied to that school, and their absolute role is to work with those students who are experiencing higher needs, more intensive needs of mental health services. And I say that higher needs because when we talk about mental health, we look at 3 tiers. We use the multi-tiered system support model. Tier 1 are those students, all students. We provide universal, just baseline social emotional learning programs for children in general. And then as students are identified as needing more interventions, they move to the tier 2. And those are where our services start to pick up for those students who are experiencing greater needs. And then the tier 3, the more intensive needed students, we even have the opportunity to refer students at that level to the outside agencies that we have contracted with through the mental health assistance allocation. And it's a collaborative effort. It is by far not just our mental health coordinators. They work very closely with all individuals in the school site. Every school has a mental health team, which includes administration, a teacher, mental health professionals. Parents are involved when a child is needing support at that level. And we also bring in the contract agencies that a child may be working with as well. So we're looking at all angles, all lenses. Now, again, that work has been taking place for 2 years. When we reached the point of school closures in March and we were faced with the pandemic, certainly there was concerns of higher needs now that children were going to be in isolation. They weren't going to be at school. They were doing everything from a distance. We quickly moved from our face-to-face work to virtual work. We moved to the telehealth counseling route immediately. So we continued, even though we were closed, and actually we're still working at this time with these students. Our individual coordinators work all year long. They have not stopped servicing students and families that they were already working with. And once we shut down, we still continued to take on new referrals to ensure that we were meeting the needs of all students and families. And when we say this, it's clearly not just that one coordinator. These coordinators are very clinical. They're licensed, they're certified, they're clinical. They all basically have all come from the private industry. That is the type of work that they did. And we are so fortunate to have that now within our school sites, within our district.
During this pandemic, have you seen the number of students increase from how this has affected our numbers of referrals of students needing our assistance?
There's a couple of different ways to look at it. Our coordinators are doing more work with some of the families now, some of the parents actually, because they are seeking help to ensure that they have the resources that they need to support their family. As far as the students go, we've seen it go in both directions. We've seen some need additional support. Some students, through their parents and the child themselves, say they are actually adapting fine being home during this time. But regardless, we have not stopped seeing those students. It might be just a quick check-in because now maybe they're okay today, maybe a week later they're not. And they were referred to us. There was a reason there that they were referred to us from the beginning.
And I know as we have these coordinators directly tied to a student, but like you said, it's about the whole family. As our coordinators speak to the child and the child's parents, and we're also able to assess other issues going on to be able to provide full support for the whole family.
Right. And we've always said from the very beginning that physical health is so important, but mental health is just as important. The two absolutely go hand in hand. And during this time, like I said, our coordinators, whether it was giving them resources for grief counseling for families, or it could be providing them resources where to go to get help with food, or where could they go to get support with their housing. They are really have found themselves providing wraparound services for these families. And again, our coordinators connect so beautifully with the agencies that we already contract with. And they cover from county line road to county line road. And they are out there, and they, before the pandemic, they were providing home services. They were doing services at the school site or at the agency. And they made the switch to virtual as well. And some of them on as needed cases are actually going to the homes too, to further support. So it's a real team effort.
That's an amazing work that our coordinators are doing. So where we know we had a lot of referrals through our mental health department, and we identify those students that are already receiving services, have we seen new referrals that typically are students that may not have needed our help through our mental health services, but because of the situation, it's, isolation?
It has not been an astronomical amount. What we have done is we have a parent assistance line. It's 305-995-7100. Again, 305-995-7100. And that phone number, it's available Monday through Friday, 8 a.m. to 4 p.m. And we have really pushed that number out because during this time when children weren't going to school and parents were not able to contact the school as we usually were, we put that number out. We have seen an increase in phone calls on that number.
We're touching upon this point, and many of our parents in general may not know what some of the signs are for mental health. And I know it's a topic that's hard for everyone. What are some of the things that we identifiable that we know we have to intervene and provide assistance to that child?
That was a great question. And I'm glad you mentioned that because a big part of our department in general has been about bringing attention to mental health awareness. We talk about it, but what really is mental health? What are the signs? What are the concerns? And we do a lot of training within our schools for our staff. We have a lot of programs for students, and we've branched out even further in the last year to more awareness trainings for parents. Typically, as psychologists will tell you, that the key with really determining that this is more of a concern than just a day here, a day there, is if a child is isolating themselves, or if they are not coming out of the room, they're sleeping long hours at 2 weeks or longer, That is a great, great concern. And that is when a child should be referred for mental health. And it might be just be for an assessment, for a screening, changing in their eating habits, changes in their hygiene, changes in just their general attitude. They were a happy kid and very jovial, and then all of a sudden very quickly irritated. Some of the things that we really encourage parents to do during this time, and we know it's not easy, but it's so important to try to stick to the basics of maintaining a routine for your child. Keeping a very simple, similar routine day in and day out for your child. In addition, and we know that children aren't able to see each other so much and be in large groups, we know that. But there is still importance that children do have some opportunity in some venue to connect with their friends on a regular basis. Also keep in touch with loved ones. And exercise and being active is very, very important for everybody, really, because staying inside so long can have negative effects on you. So they tell you to get out, get some fresh air, and be active and take it from there. And then lastly, what's just so important is to seek help. There's nothing wrong with seeking help. And through all of the programs that we have put out in the last 2 years, we have absolutely heightened the awareness. We're eliminating a lot of the stigma that went with mental health because, again, we go to the doctor. If you break your arm, you go to the doctor, you get it fixed. If you sprain your ankle, you go to the doctor, you get it fixed. We're moving better in the direction now that when there are some concerns, whether social, emotional, or deeper mental health concerns, there is nothing wrong with going to get that help that is needed. And we're happy to say that we can start it right here in our schools in Miami-Dade County Public Schools.
Thank you, Sally. And I think you hit on a very important things that parents can do. I always find as a parent that when you have a routine, the child really is more disciplined, is able to move from face to face. And as a parent, I would say, even if you're listening and you are the ones that cook at home, involve your children in making breakfast, making lunch. Like Sally said, go for a walk, get a table out in your backyard, draw, do painting, walk your dog. And I think that will go a far way ahead to be able to at least be able to carry some sort of routine. And I know parents at the same time, Sally, we're helping our children during the virtual learning, but also doing their work. Many parents in our community lost their jobs. And like you said, those conversations where typically maybe a child would have been in school if a parent lost their job. Now the child is home listening to the adults discuss these issues. And I think it's very stressful for what many of our children have gone through.
It is. We always say we work with students and families, but now more than ever, we are working with students and families and providing wraparound services, wraparound support, wraparound resources to really assist with the physical and the mental needs, because at the end of the day, it all falls under health. It's really everybody's job. Not everybody is going to report, I need help. There's still, it's not always so easy to identify. Some things are very obvious to look at. Long sleeping too much, their hygiene, things change, their weight changes. But there are some cases where a child, you just cannot, it's not an obvious early warning sign. But what's important is sometimes to listen how people speak, because we have had opportunities to enhance the referral process by all the trainings that we've done, where teachers are picking up signs. Some of the parents are, through some of the trainings they're attending, are picking up signs. And really, we're starting to see even students through the trainings that they're going through to understand, hey, that's me and I need to go get help, or my friend has now acted differently. And we're starting to see students refer their peers.
Good. And that's what comes with awareness. And that's exactly what we've been trying to do through your leadership and our superintendent and board's leadership throughout our community. We really have taken this department to a whole nother level to provide those wraparound services. And I know, Ms. Alayon, we have a lot of children with special needs. I talk to a lot of parents who have children with autism, and particularly, I know this has been very, very difficult. What have you seen in that population?
It affects all students, and I know our exceptional student education department has been very involved, in particular with those children who fall under the special needs because they have special avenues and ways and even heightened resources to assist those students, whether it be mental health related or just some social emotional tools. But again, yes, it doesn't stop there.
Thank you. At the end of the day, I think parents that are listening, community, if you hear, even if a friend is saying, my son is doing this, that is why we're here, to be able to guide you and support you during that process of assessment to see how we can help the child and the family together. So, Ms. Alayon, the number is 305-995-7100, 7100. That is our MDCPS Mental Health Services Assistance line for anyone where we want to help the children. We want to get them very early so that we can identify and our coordinators could be connected to provide the support that they need for the child.
I do want to stress that line because when we are in school and we see the children and, there's more involvement activity face to face, the referral process might be a little bit easier at the forefront. With the distance, we don't always know. So we really encourage, please call that number. One of our licensed mental health professionals answers it all day. And that same day, those parents get a phone call from the coordinator who services the school where that child attends. They make that automatic connection and the process works. The process starts from there. And by the way, I wanted to also mention in our district, we do have counselors and social workers. We have other folks that are supporting this work too. But to move back to the mental health professionals that are hired through our department, yes, they are working with individual sessions one-on-one. They will do a group session, and they certainly do those family counseling sessions as well. All of our contracted agencies who are doing a great job, they're great partners with us. They provide those services. And again, for the more intense needed students, we make those referrals to ensure that they get that support that they need. And by the way, those services are free. Those are absolutely free. Of course, our coordinator, our in-house services, certainly, but when we connect parents and they consent to it, yes, please provide us those services, connect us with those agencies. Those services are free to our families and our students.
Thank you, Sally. I think this is very valuable information as we continue. Our children have been home now for 5 months since March. The summer's here, and typically this is the time when children would go on vacation with their families, be able to play and spend that quality time to rest their minds. But unfortunately, we're still in this pandemic. And as this probably will go into the fall, we need to provide our children and our families with all the assistance possible to get through this, not only physically, health-wise, but also mentally, because like Sally said, it is as is important not only to take care of our health, but also our mental health. And this parent assistance line is available for free, and the agencies that the school district has approved for contracting with, they're available to be referred to for the entire family. So, Sally, what is the website of your department? If you can give that for the listening audience.
mentalhealthservices.dadeschools.net. mentalhealthservices.dadeschools.net. And we house so many different resources on our website for students, for families, for staff. We have several very important links that are on there, very important phone numbers that are on there. We have all of that listed on our website. And I'll say this, Dr. Navarro, too. As we are in summertime and our work has not stopped, our work with students and families has continued. It's year round. But we are ready to make that transition for reopening, whether it's face-to-face or virtual. We know that could bring some challenges for students coming back in either direction. And we're working with all the departments within our school district to provide reopening activities, social emotional activities to help with an easy transition for students as they return, whether it's virtual or face-to-face, and ensure that those students that it seems to be that they are needing more assistance, then they will be referred to our coordinators at that time.
Well, thank you. Thank you, Ms. Alayon. One last tip. What can you tell parents if there's one thing to focus on?
Absolutely. You need to know what your child is doing. You know your child best. And if you're starting to see changes in them, as we said, in their sleeping habits, if they're showing anxiety, if they seem more irritated, they're withdrawn, they're eating differently, they need to be referred immediately. Don't hesitate. Don't wait. It might just be one phone call and might not need to go very far. But if there is a concern, research shows that children, and we're looking at 1 in 5 students have some type of a mental health challenge in their lifetime. 1 in 5. Early intervention is the key. So to keep your eye on your child, know your child, but do not hesitate if you have concerns or see some concerning changes in them.
Thank you, Sally. I think that's valuable information. So I want to thank you, Ms. Alayon, Assistant Superintendent of the Department of Mental Health Services for Miami-Dade County Public Schools. This is, to me, the most important topic as we continue to travel through this pandemic, this path that I know there is a light at the end of the tunnel. Sometimes you don't see the light at the end of the tunnel, but we're here to provide those services. Even if you don't know all the signs, something will tell you there is something wrong. Please know that we are here to provide assistance directly to your child and to your family. We are about families, and we need to provide the support each child needs to get through this. And also, as they come back to school, whether virtually or in person, we need to be able to also assess what they need in their mental health capacity to be able to also be academically successful. It is tied directly, just as health and well-being. And I want to thank Ms. Alayon for joining us. Again, I'm Dr. Lubby Navarro, school board member in District 7. And I ask all of you to tune in to next week's podcast. I have the honor of having Dr. Eileen Marty, who is a professor of infectious disease at FIU. And she's also my District 7 appointee on the reopening task force that the district has created. She has been part of an important clinical group along with psychologists and social workers to be able to help us make decisions about this clinical event during the pandemic. So thank you again. Thank you, Sally, for joining us. And thank you, everyone, for listening. If you have any questions and need to call my office, feel free to call us at 305-995-1334, or you could visit my district website at district7@dateschools.net. Again, thank you. Have a great day, everyone.
That concludes this episode of Lubby's Chat, brought to you by Miami-Dade County Public Schools, produced by me, Janelle Yee, and hosted by School Board member Lubby Navarro. Please email district7@dateschools.net with any questions or comments. Once again, our address is district7 with the number 7@dateschools.net. For more information, visit our website, district7@dateschools.net. You can also call us at 305-995-1334. For updates, follow @Lubby Navarro on Twitter, Instagram, Facebook, and YouTube. And listen in next week for a discussion on the potential reopening of schools with infectious disease expert Dr. Eileen Marty.